Sure. Can you hear me now? Okay, cool. It is 9 a.m. and I call this meeting to order. Please stand and we will recite the Pledge of Allegiance.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
This is a special meeting of the Winona City Council called by me, Mayor Scott Sherman, pursuant to Minnesota Statute 13D.04, Subdivision 3, for the purpose of considering a resolution declaring a local emergency and requiring face coverings in indoor spaces of public accommodation in response to the surge in COVID-19 cases in the state and in Winona County. I will now ask the city clerk to take roll call.
Mayor Sherman.
Here.
Councilman Young.
Here.
Moeller.
Here.
Alexander.
Here.
Iden.
Here.
Borzakowski.
Here.
Rapinski.
Here.
Item 5.1 is to declare the emergency and require face coverings in indoor spaces of public accommodation.
I make a motion.
Michelle, I have the floor. Sorry. We have one item of business on the agenda today, and that is to consider the resolution to declare a local emergency. This is a reminder that this is not a public hearing, and therefore the public is not allowed to speak during this meeting unless I have given you permission to speak. I have invited a few people to provide information to the council, and I will call on them now. We have Rochelle Schultz, CEO of Winona Health. Rochelle, would you give us a short, brief statement?
Yes, good morning. Thank you. I wanted to provide some situational awareness from the health and the healthcare perspective regarding COVID in our community and the surrounding area. As you're aware, our community, along with the rest of the United States, is in the midst of the fourth COVID surge, specifically recognized as the Delta variant. And characteristics of this variant is that it is highly transmissible, and thus we have high community spread, and unvaccinated people are particularly hard hit. Our county vaccination rate is low, in the mid to low 50s, 50% for the fully vaccinated. And those under age 12 don't have access to the vaccine at this time. We continue to strongly encourage folks to get the vaccine. They're safe, they're effective. And even if somebody experiences a breakthrough infection, meaning that they're vaccinated and then test positive, the vaccine provides protection from severe illness and hospitalization. Our concern also is that our breakthrough numbers are actually running pretty high. In the last 2 weeks, we've had 28% of our positive tests be breakthrough cases. Our hospital capacity for ICU and medical surge beds continues to be at this time manageable. However, in the last couple of weeks, we have experienced times of diversion where we have no beds available. Generally, we have good flow of admissions and discharges, and we're keeping watch on the COVID situation locally. Across the state, bed capacity is very low, primarily due to workforce concerns and challenges. We are on daily calls for patient placement and have taken patients from outside of our service area for both inpatient and outpatient care. However, we evaluate each situation to ensure that we have capacity for our community members first. Most of our patients that are in the hospital beds are not COVID positive. However, we have had COVID positive patients in our hospital recently. Most of them have been unvaccinated, and these patients have significantly higher acuity levels than we have seen in the past, and their hospitalization is much longer. Workforce challenges are the primary factor influencing our bed capacity for hospitals and long-term care facilities in our community. And it is critical for us to ensure that our staff remain safe and protected so that they're available to care for our patients and our residents. Which brings us to the issue at hand of masking. At the onset of COVID last year, we dealt with limited testing capabilities, limited PPE, and limited treatment options for patients with COVID. Masking, along with other infection prevention practices, such as social distancing, hand washing, and constant cleaning, provided all of us with solid protection against contracting the virus, and that remains true today. I know that we all understand that we're not going to reach 100% and likely not even 70% of people being vaccinated in our community. That said, we can slow down or stop the spread of infection, and we can reduce severe illness and hospitalization through masking as another line of defense. Further, given our breakthrough rates, this practice is important for both vaccinated and unvaccinated folks. I wanted to provide an example. In 2020, for the first time, we did not see a single case of influenza in our community. And while we did provide influenza vaccinations, it was masking along with other infection prevention efforts that provided that greater level of protection. And in effect, we eliminated influenza in our community. Typically in the US, influenza causes about 35,000 deaths annually. However, in 2020, there were only 1,000 deaths, which is a remarkable result, and it provides a great lesson for our current COVID situation. There's many lessons that we learned last year and that we don't want to forget. At Winona Health, we don't want to be put in a position to have to close services or limit care to people, and we're committed to ensuring that these things do not happen. Our physicians, nurses, clinicians, and support staff are committed to providing outstanding care to our patients, whether they have COVID or not. We are all experiencing real time how a viral pandemic impacts our lives on every front, particularly as the virus mutates. We are not out of the pandemic yet, and our respective actions matter. As we each make personal decisions, it's important to reflect on the impact that these have on those that we love, that we live with, work with, care about, and come into contact within our community. Thank you.
Thank you, Rochelle.
Mayor, excuse me, may I ask Michelle a question?
Yeah, absolutely.
Michelle, did you have a mask mandate in place last week at the hospital where if you're?
We have had masking has been in place in healthcare facilities all along. It never went away. So
Okay.
Hospitals, long-term care clinics are all required by Minnesota Department of Health to have masking in place.
Okay, thank you.
Yeah.
Any other questions for Rochelle? Okay, I believe we also have Winona County Public Health, either Karen Sanis or Melanie Tetke available, and they were going to do a short presentation as well. There's a couple things I'll mention real quick. The council packet that we have received and that is online right now includes both a resolution to approve and or a resolution to rescind the mask order. This morning, we received 3 new documents. These will be uploaded to the city site after the meeting. So we received them too late, but all council members do have this information in front of them. Brad, do we have someone from the county here?
Good morning. This is Karen Sanis. I'm the Health and Human Services Director for Winona County.
Okay.
Melanie Taji will also be available to provide you information and data regarding COVID-19 and our current state here in Winona County. I just wanted to be able to come on and provide you with some information. I also am the Community Health Services Administrator for Winona County. And as part of my role as the Community Health Services Administrator, I am required through statute, Minnesota Statute 145A, to control the spread of communicable disease. We control the spread of communicable disease through mitigation strategies. Mitigation strategies are social distancing, hand washing, cleaning, and mask wearing. And so we need to stop and control the spread of any type of communicable disease, and we are required we are required by law to try and attempt to do that. The county right now is not in a position to be able to do a mask mandate, but potentially working towards that. Mitigation strategies are non-therapeutic interventions that everyone can do to help control the spread. This is everybody's responsibility. It is not just public health. It is not just the city of Winona. It is everybody within the county and the state of Minnesota and in the US to be able to do these mitigation strategies to control the spread of communicable disease. I just want to preface that mask wearing has become a political, has entered the political arena. And when issues like this enter a political arena, decisions cannot be made just based on the voices of those in the political arena. We need to take it outside of the political arena, and we need to make our decisions based on what is based on the good of the whole community, and not just those voices that we hear from the political arena. We need to have that broader picture available to us. So at this point, I will turn it over to Melanie Taji, the Health and Human, or the Public Health Manager for Winona County, and she will provide you the most up-to-date information. That we are seeing, we are in a surge right now, that we're trending higher with our case rates right now than we were last year at this time. Which is concerning considering the amount of vaccinations that we do have. We also are seeing new strains and new variants coming our way. We have a Lambda, I believe is the name of the new variant that has now been found in Canada, which is of course on the North American continent, which will only be a matter of time before it is in the United States and in Minnesota and in Winona County. So there is also another variant that has been identified in India. They call it Delta 2.0. And that is also another highly contagious transmission, very highly transmissible variant that we are going to be seeing. We're in this for the long haul. This is not going away anytime soon. We need to continue to vaccinate. We need to continue to booster. Any of those individuals out there that have autoimmune disorders need to get that third dose immediately. So I will turn it over to Melanie Taji, our public health manager, to provide you with the most up-to-date information. Thank you.
Thank you, Karen. Good morning, Melanie.
Thank you, Karen, and good morning, everyone. Thank you for letting me attend this meeting. I do have a PowerPoint presentation, like Karen mentioned, that it looks like I'm unable to share at this time. So I did send that to Luke Sims. Is there any possibility of getting that on the screen for all to see?
This is Brad, the IT coordinator. Go ahead and share your screen now.
Thank you. Okay. Okay. So on this slide, for those of us who can see, we have Winona County's COVID-19 epidemiological curve as recent as of yesterday. What this slide shows is on the x-axis, the months that we have been in. Unfortunately, we have been over 12 months, so that 13, 14, 15, 16, 17, 18, 19, 20 are the months for the 2020 year. On the y-axis, we have the number of cases. The different colors that are being represented on this graph coordinate with a different city. The city of Winona is that gold color. So as a point of reference, this is the month of November. That is when we had the November surge. If we go over to the right end of the graph, you can see where we are in the month of August. As a point of reference, here we are, month 19 was July. We started to see an increase of cases to the mid of end July at an exponential rate, which I have additional data to show that. As you can see, that pace has been continued to climb here in the month of August. We are seeing this increase of cases across our country. We are seeing these case of increases across our state and in our region. What is driving these case increases is the Delta variant. We're seeing the majority of the cases being reported in individuals 16 to 49, which is a much younger demographic than what we've been seeing in the past. And most of the cases are for individuals who are unvaccinated.
Melania, this is Brad again here. Can you just set your screen to be a different screen? We're just basically seeing the notes of the slideshow in a much smaller graph.
Sorry, let me see if I can do that for you.
Should be able to just change your screen.
So I did slideshow last time. Let me, if I click it again, is this, are you still seeing the same thing or?
Just a black screen right now.
Okay, if I go this way, can you see the slides better?
Hey, here we go.
Great. Sorry about that.
Better.
Thank you so much.
My pleasure. So on this slide that you will see is the number of COVID-19 cases reported for the month of July and August, starting July 26th to August 25th. That x-axis are the different dates of July and August, and the y-axis is the number of cases. As you can see, since July 26th, the entire county has been on an increasing trend. On the right-hand side of this slide, you can see the number of cases that we've been averaging as a county. So back in the week of July 25th through July 31st, we were averaging about 4 COVID-19 cases being reported a day. That was an increase of maybe averaging 0 to 1 cases a day in the county. If we flash forward to today, we are at 30.2 COVID-19 cases a day of what we are averaging. If we compare to this to where we were at this time last year, you will see on this slide, the blue line on the slide is 2020 COVID-19 cases. And the orange slide is where we are at in 2021. The x-axis are the different months of the year. And the y-axis is the number of cases that are being reported in Winona County. If we look at month 8 for August, you can see that we have had a significant incline of cases. We are about approximately 70% more cases being reported compared to where we were at this time last year. And if you see, we're about where we were in October of this last year case-wise, which brought us to that November surge that we experienced last year. As Michelle mentioned, you just don't look at the COVID-19 cases to get a full picture of what's going on within the county. We need to look at the resources, the hospitalizations in our community. And that is what this slide shows for the state of Minnesota. On this slide, you will see the months of the pandemic starting in March 07, 2020 to August 14th of 2021. The y-axis is the number of cases or rates per 100,000 individuals in the state of Minnesota. And the 3 different colors of lines are different age groups. So that red line is our 65 plus, the blue line is 20 to 64, and then that teal line is our younger population. This is the November point of reference. If we go all the way to the right-hand side of the slide, you will see that we are on an incline of hospitalizations as well. For the current status of Winona County as of yesterday, there were 18 new COVID-19 cases reported. That brings Winona County's total COVID-19 cases since March 25th, 2020, when we had our first COVID-19 case reported, to 5,058 COVID-19 cases. In the last 7 days, we've had an increase of 114 COVID-19 cases. Since August 19th, there have been 2 new hospitalizations, no new ICU admits, but we have had ICU admits in the month of August, and no new deaths. The 14-day case rate, so the number of cases for a population of 10,000 Winona County residents, is 6.279 COVID-19 cases per 10,000. In the last 14 days, there have been 317 new COVID-19 cases being reported. And then our 7-day COVID-19 case growth per 100,000 Winona County residents is 402.11. And the Winona County positivity rate, which is all individuals who are currently seeking testing at the Winona County semi-permanent testing site that's located in the Winona Mall, is 8%. What that 8% means is that of those individuals who are seeking out testing, 8% of them are testing positive. These last two bullets on this slide are the two factors that the Center for Disease Control is looking at to determine what level of risk transmission different counties are in for COVID-19. As a point of factor, which I do have a different slide on this, if we are 50 cases per 100,000, we are in substantial risk. Anything over 100 cases per 100,000 is high risk. And then anything over 10% positivity rate is high risk. The CDC uses whichever factor is higher to determine what the COVID-19 transmission level is for that county. And I'll come back to that to speak about that a little bit more. As for Vaccination Reach, which Michelle did mention, for Winona County specifically, for our eligible population, which is 12 plus, approximately 61% of that population is vaccinated. That is 27,450 Winona County residents out of 44,769 Winona County residents. If we go to our total population, 54% of our population is vaccinated with 1 dose. We need to be at 70% for herd immunity to kick in to provide that protection to all. This slide shows the different CDC and Minnesota Department of Health COVID-19 transmission thresholds that I just mentioned on 2 slides before this. Winona County, since the launch of these thresholds, has been in orange or substantial transmission risk to high COVID-19 transmission level risk. And Winona County has been in high transmission level risk for the past 2 weeks. On the right-hand side, you will see the Minnesota Department of Health metrics. You can see that they mirror the CDC metrics with some variation, but Winona County has been in high risk since the launch of these metrics on July 28th of this year. I did take the opportunity to break this down to the city of Winona specifically. So for the last 14 days from August 21st through August 7th, city of Winona has averaged or has had 1.6 cases per 1,000 city of Winona residents. If we looked at that factor that the CDC uses to determine the level of COVID-19 risk within the city of Winona, for the last 7 days, there's been 28 cases being reported in the city of Winona, and the city of Winona has been the city that has the majority of the cases being reported within. That is a 1,044 COVID-19 cases per 100,000 city of Winona residents. As a point of reference, anything over 100 cases is high COVID-19 transmission level. If we compare that to the county on a whole is 2.63 for 4 cases per 100,000 and 47.73 cases per 10,000 Winona County residents for a 14-day case rate. How this looks like across the county over time. So what this slide shows is the different weeks since July 18th to August 15th of August 21st. The x-axis shows the number of cases. Those blue lines is our 7-day case growth for Winona County. And then that smaller percentage number is the percent positivity rate that was being reported at that Winona Mall COVID-19 testing site. As you can see for our positivity rate, we have been fluctuating around 10%, which identifies as a high level of transmission. For the blue bars, you can see we've been on a incline of the number of 7-day case growth that Winona County has been experiencing, with last week having us being at 263 COVID-19 cases per 100,000 Winona County residents. Karen mentioned the presence of COVID-19 variants. Throughout the pandemic, there have been multiple variants presented. As within any virus, it's going to do its best to adapt and thrive to survive in the community. The virus does not want to die. So how it does that is it genetically mutates to become different versions of itself until it thrives to find one that's going to spread the farthest. The majority of cases, approximately 80% of those being reported in the state of Minnesota, are from the Delta variant. This variant was first identified in India. It spreads more than twice as easily compared to earlier strains. It's being compared to the chickenpox with how easily it spreads. The severity of illness is that it is more severe compared to the original version of COVID-19 virus and other variants. Individuals who carry the Delta variant carry a higher viral load. So what that means is that they're more of the virus within their body or more potent. And a study in Canada and Scotland showed that the Delta variant was more likely to cause hospitalizations than the original strains. This poses a threat to our unvaccinated individuals. A lot of individuals are reporting to this Delta surge as a pandemic among the unvaccinated. As Rochelle mentioned, the vaccine is providing protection against the Delta variant in ways that it's lessening the severity of symptoms, lessening the chance for hospitalization, and lessening the chance of death. One thing that is a concern is that individuals who are fully vaccinated can spread this virus to others and can but appear to be infectious for a shorter period of time. And I apologize for the typos in this. The other concern is that there are COVID-19 treatments out there. However, they're being less effective against this variant, which is a concern as well. For the Lambda variant that Karen presented, that variant is a variant of interest. It was first identified in Peru back in December of 2020 and has spread to South America and North America. There have been confirmed cases in the United States, in California, and it's only a matter of time, just given the nature of the virus, that it will come to the state of Minnesota. There are multiple different definitions of a variant, and the Lambda is currently being a variant of interest. The Delta is a variant of concern, meaning that it's here within our country, whereas a variant of interest means that it is a concern. However, it's not across the entire country yet. And on this slide, you will see the World Health definition of a variant of interest. How it has identified that is that it's significant community transmission. There's been multiple COVID-19 clusters of this virus in multiple countries in an increasing relative prevalence. So it is an area of concern. However, in our state at this time, which this was what this slide shows for the region 5, which includes Illinois, Indiana, Michigan, Minnesota, and Wisconsin, you can see that the Delta variant, which is this orange color on the slide, is the majority of the cases that were being seen. What this slide shows is on the x-axis, the different date timeframes. So this slide is as recent as of August 21st. And then on the y-axis, you'll see the percent of the COVID-19 cases that those varying different variants comprise. So the B.1.1.7 variant is the variant that originated in the United Kingdom and was the majority variant back in May. But as I mentioned, that dark orange has quickly taken over, and that's the Delta variant. So what can we do to help mitigate the spread of a COVID-19 virus? This slide is a Swiss cheese model. So we all know Swiss cheese has holes in it. However, I don't know about you, I really like a cheesy sandwich. So I layer multiple different cheeses to get the best coverage of my sandwich. The same thing applies. If you layer multiple different mitigation strategies, although none of them are 100% effective, but if you layer them, the more effective they become, and the more effective they are at reducing the populations and one's risk for contracting any virus. On this slide, you can see that there's personal responsibilities that we can do on an individual level, such as physically distancing, wearing a mask, doing proper hand hygiene, avoid touching our faces, and avoiding crowding spaces. Those are all things that are in our control. However, there are shared responsibilities that we can also do to help protect and promote the community. Masks are also a part of doing that, but you'll also see that rolling up our sleeves, getting the COVID-19 vaccine can help, adhering to quarantine and isolation, having governmental support, having proper ventilation indoors, and then getting tested as soon as you identify symptoms or are identified as a close contact. The more we layer these mitigation strategies, and that is what the CDC and MDH is strongly encouraging we do, the more that we reduce our risk of COVID-19 transmission within our community and protect ourselves and protect our loved ones and help us be on a decline for those COVID-19 cases. This is the current Center for Disease Control and Minnesota Department of Health COVID-19 guidance regarding masks. This was announced around the end of July of this year. So the CDC and the Minnesota Department of Health mentions that the Delta variant is a much more contagious version of the virus compared to other versions, and that the CDC is now recommending that for the following for people who are vaccinated, which is more than 2 weeks from the last dose of one vaccine. To reduce one's risk of being infected with the Delta variant, the CDC and the MDH has adopted their recommendations is to strongly recommend wearing a mask indoors, or if you are in an area of substantial or high transmission. And they're using that slide 8 to determine that level of transmission, which, whereas I've mentioned Winona County has been in high level of transmission for the past couple of weeks. They're also stating that fully vaccinated people may choose to wear a mask regardless of the level of transmission. And they do recommend it to do so if you have a weakened immune system due to age or underlying medical condition, if you're increased risk for severe disease, or if a member of your household has a weakened immune system, or is at increased risk for severe disease, or is not vaccinated. And then they're also recommending that anyone who's identified as a close contact seeks out testing 3 to 5 days after their exposures, and also wear a mask for 14 days following their negative test results, and isolate if they come out positive. So the question that comes up, are masks effective? On this slide are a variety of different resources that show the effectiveness of masks. There are a variety of different masks out there. Some are more effective than others at preventing the risk for COVID-19. But how they work is if you place the face covering or the mask over your face and nose, it helps reduce the transmission of the virus to those around you. And as mentioned in the switch to slide, this is one mitigation strategy that we can use to help lower our risk and further mitigation of the virus. And the last thing that I wanted to end on today is I do understand that there's a variety of different COVID-19 information that's out there. I would just highly recommend that if you're checking resources, that you just verify that your sources are credible. And I wanted to provide a tool that we can all use to determine if a resource is a credible resource. And it's with the acronym SMART. So first, you need to identify who the source is. What is the source? I don't recommend Wikipedia. It just doesn't always come from the most credible resources. But I would recommend looking at the World Health Organization, the Center for Disease Control, the Minnesota Department of Health, Winona County Public Health, or any website that has a .org or .gov at the end of it. The next part of the acronym is M, which means motive. Why do they say what they do, or the reason behind this study? If you're looking at data specifically, some questions I ask myself is who funded the study? What are the reasons for the study? And what is their population that they're using for the study? Is it a representative sample of the population at the whole? Is it in a similar demographic to what Winona County is? If the answer is no, it may not be the best credible resource to look at. The A in the acronym is who wrote the story. Are they credible? Are they coming from the World Health Organization, CDC? Are they linked to a credible foundation like Johns Hopkins? If they aren't, Then you go to the T, which is the two-source test, which I'll get to. But the R in the acronym is review. Is there anything that pops out as potentially untrue? We live in a world where we have the ability to fact check things. Again, I would review it again to see, is it a representative sample of the population? Does it mirror to what maybe could be happening in Winona County, and who funded this study? And then last but not least, if there's any concerns with a source that you're reviewing, do the two-source test or like a fact check. How does it compare to other resources out there? How does it compare to other credible resources out there? And if it doesn't compare, it may not be the most credible resource. So thank you for letting me come today. That is all I have.
Thank you, Melanie. Appreciate it. Do any council members have questions of Melanie, Karen?
Melanie, Aaron here. Thank you, Mayor. When you gave the statistic of 54% of Winona County is vaccinated, is that including children that aren't eligible, or is that only eligible people?
Great question. So that 54% does include the current uneligible population. For the population that is eligible, which is the 12 plus population, we're at 61% of being vaccinated for the county.
Okay, thank you.
My pleasure.
Any other questions? Okay,
Then I'd make a motion to rescind the local emergency declaration.
Steve Young, second.
we have a motion from Michelle and a second from Steve. Any discussion? I would like to say that the information that we have just looked at and the people we have heard from, these are the people that helped me make the decision to move forward on an emergency order. I think it is fairly clear that based on the information and the conversations that we've heard today, we are in an upward trend. And at that point, I needed to take a measure to try and protect our community as best I could. This is not an easy decision. It is something I had been working on for the last couple of weeks in terms of looking at all the repercussions of what this could do to our community and or what it could do in terms of potentially saving lives. And that truly is what this comes down to. I made this decision on my own based on the information that I had from my trusted health sources to try and save lives. I've said it before, I will say it again. Inconvenience will never outweigh a human life, in my mind. And for that reason, I made the decision to enforce the mask mandate on Wednesday. I would ask all of you to please consider the immunocompromised, the populations that cannot be immunized or vaccinated at this time. And I ask you to truly look inward at yourselves and do what's right in your heart. And that is what I am doing. I will be voting based on what my upbringing has been, what my values and my ethics are. It's a difficult decision, but it was something I felt I had to do. Any other discussion, comments? Hearing none, all those in favor say aye.
Aye.
All those opposed? Nay. Motion is denied, or motion passes to rescind the emergency order.
The time being 8:50, I'm sorry, 10:50. Is that correct?
9:40.
Thank you. 9:37, glasses, people, I need glasses. And there being no further business to come before the council today, I move to adjourn.
I will second that.
All those in favor say aye.
Aye.
Opposed? Meeting adjourned. Thank you, everybody.